Hello everyone, it's Fred Huerta with Nightingale College, and today I'm going to be demonstrating administration of oral medication. First thing we're going to do is verify the healthcare provider order. I'm going to be working with MAR1, so the first medication we have is Docustate Sodium, 100 milligrams, 100 milligram tablet. Next we have Warfarin, 5 milligram tablet. Next we have furosemide, 20 milligram tablet. We have potassium chloride, 20 milliequivalent tablet. Then we have acetaminophen, 500 milligrams per 15 milliliter fluid. Okay, so now we're going to verify the 6 rights of medication administration, which are the right patient, drug, dose, route, time, and documentation. Okay, now we're going to perform the calculations needed for for our administration. The medications we're going to be administering 15 milliliters as the order reads for acetaminophen, the liquid solution. The pills, we do not need to perform any calculations. We're just going to be administering them just like that because they are already calculated for us. Okay, so we're going to go ahead and knock on the door, perform hand hygiene, and introduce ourselves to the patient while we pull the curtain for privacy. Hello, Mr. Victor. My name is Fred. I'm going to be your nurse today. Could you please tell me your name and date of birth? Okay. I'm just going to verify that your name with the wristband. Make sure that name correlates with the name on the order. Okay. I'm going to ask the patient, is it okay to proceed to speak about your healthcare information in front of your guests here? Yes? Okay, great. Okay, Mr. Victor, do you have any known allergies you could tell me of, such as allergies that are seasonal, allergies that are seasonal, medication, or to food? No? Okay, great. Um, so we're gonna go ahead and I came in here today because your doctor has ordered for you to receive 5 medications orally. I'll explain to you the uses, the common side effects, and the adverse effects of these medications as we go. Before we do that, I want to do my pre-assessments before we administer these medications. So for Docusate Sodium, I want to for Docusate Sodium, I want to make sure that the patient is not vomiting or has diarrhea. For warfarin, I want to make sure that the patient does not have excessive bleeding or bruising. For furosemide, I want to make sure that assess my patient's blood pressure and pulse. And for potassium chloride, I want to assess the patient's blood pressure and pulse as well. And for acetaminophen, I'm going to go ahead and make sure my patient does not have any liver complications. And yeah, okay, so now that we've done the pre-assessments, I'm going to go ahead and explain to my patient all the medications. Okay, Mr. Victor, so we have order here for Docusate Sodium 100 milligrams. This is a sodium. No, I'm sorry. This is a um, stool softener. It helps to treat constipation. The medication is some of the common side effects of this medication are abdominal cramping and nausea. Some adverse effects of this medication would be facial swelling and rash. Okay, so place that inside. And then we're going to have warfarin, 5 milligrams. This medication is anticoagulant. This medication is used to treat blood clots. Some of the common side effects of this medication is a slowed healing process for wounds, and you can experience bleeding of the gums. To prevent that, we recommend using a soft bristle brush. Okay, some adverse effects of this medication would be if you're coughing up blood, if you are, if you have blood in your stool or urine, and yeah. Okay, so those are some of the common side effects. I mean, the adverse effects. Please let us know if you're experiencing that, and we will let you know. Okay, next we have furosemide, which is a diuretic. This medication is used to excrete fluid from your kidney through your kidneys. It also lowers your blood pressure. Okay, this medication's common side effects are increased thirst and headache. Some adverse reactions of this medication would be weakness or muscle cramps, muscle cramps or weakness. Okay, please let us know if you're experiencing that, and we can help assist you. Okay, the next medication that we have is potassium chloride. So potassium chloride is a potassium supplement. This medication's common side effects are nausea and gases in your stomach. So you're gonna have you might have some abdominal discomfort. Some of the adverse effects of this medication would be heart palpitations and generalized weakness. Okay, so please let us know if you're experiencing that, which can mean because that can mean something more severe, and we would want to get you help right away. Okay, so the last medications you're going to be receiving, the acetaminophen. This medication is antipyretic, analgesic. This medication is used to treat pain. Some of the common side effects of this medications are decreased appetite and nausea. Some of the adverse effects of this medication would be extreme abdominal pain and a rash. Okay, so let us know if you're experiencing that. Okay, so next we're gonna do you have any questions for me at this time, Victor? No? Okay, great. I'm gonna go ahead and perform hand hygiene, put on some gloves. Okay, put on some gloves. And this is where I'll perform my last verification of medication, making sure all these medications match up with the patient's name and the order that we have. And it looks about right. So I'm going to start off by giving the patient the liquid solution. So it's Tylenol, acetaminophen, 500 milligrams, 15 milliliters. So I'm going to go ahead, cover the label to prevent it from dripping onto the label. We're going to shake it for the necessary amount of time. And then we're going to go ahead, uncap it, place the cap facing down, like that, onto the bottom. Okay. And then we're going to pour this on a flat surface. Okay, flat surface. And we're going to be administering 15 milliliters. Okay, so next we're going to grab our tissue and clean the side. Do not clean the inside, just around. Then we can cap our medication. Place that aside. Okay, so administering 15 milliliters. See that? Okay, great. So now, here you go, Mr. Victor. Here's the acetaminophen, 500 milligrams. Okay. You okay? So I have the patient seated up in a seated position. Okay, now I'm going to go ahead and, so this is going to be the DocuSate sodium. Mr. Victor, are you do you prefer to drink the medication all at once, the pills, or would you like to take them separately? All at once? Okay. So that's the warfarin. Then we have the furosemide. And then we have finally the potassium chloride. Okay, so I'm going to go ahead and give the patient the medication. And then we're going to be using this starter fluid over here as water. It's not going to give the patient starter fluid, but we're going to give the patient, this is water after administering the pills. Here you go, Mr. Victor. Okay. You feeling okay? Okay, so just I'm gonna have you seated up in a position comfortable. Here's your call light. Just let me know if you need anything. Okay, I'm gonna be doing my rounds, be checking up on you. If you feel anything, if you have any questions, please let us know. I'll come ahead and answer those questions as to the best of my ability. Okay. So now I'm gonna go ahead and dispose of all my trash. I have the patient in a comfortable position with the call light and the bed fall risk precautions are put in place. I'm gonna go ahead and remove my gloves, perform hand hygiene, and then document the procedure.